Hello, welcome to AMCI Saturday Study Session, or SSS. I'm Mrs. J, Curriculum Director here at AMCI, and I am delighted to present AMCI Lead Instructor Ms. Tamika along with her guest. Without further ado, let's get started. Take it away, Ms. Tamika.
Good morning. How are my coders this morning? I hope you guys are doing well. I hope you got that CPT manual. I hope that everybody also has a pen, paper, book, all of that good stuff. All right, guys. I am looking to hear from you guys in the chat. Let me know you are out there. I see Miss Cheryl is out there. Lisa, Regina, Sabrina, Soma. Good morning. Yeah, there you go. Look, I gotta have some interaction from you guys in the chat because I need to know that you can hear me before I start reading scenarios. All right. You guys know what we're doing this morning: anesthesia and radiology. Now, I don't know what everybody's hair situation is like with COVID and everything, but hey, you do have to get a little bit creative when the visit is long overdue. But I know you guys are looking beautiful. All right. Hey, Miss Lisa, I'm glad you're excited to be here. Good morning, Soma. Good morning to you, Miss Cheryl. Good morning to you, Miss Regina, and you too, Sabrina. All right, here we go. Our copyright, CPT copyright 2020, American Medical Association, all rights reserved. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, Chun, AMCI FAP 7, AMCI ICD 10, Flip, Tap are trademarks of AMCI. All righty, let's do some time scenarios. Hey, I might be telling just how old I am, but I love myself some Flintstones. So, hey, let's clock in and let's get ready to roll, okay? All righty. All right, we're going to this anesthesia section, and you guys know you're ready. You're ready. I know you are. You are so welcome, Cheryl and Sonia. You guys are welcome for the page turning tip. All righty, I'm going to read this one real quick, and you know how I love to say Miss Andrea for my quick one. So we got two quick ones straight out the gate. I know you guys are already looking for it. We have A01962, B01963, C01969, D01967. Report the appropriate anesthesia code for an obstetric patient who had a planned general anesthesia for cesarean hysterectomy. All right, I'm going to give you guys just a few moments and pop your answers in the chat, guys. All right, I think everybody's got those answers in there now. All right, so we're gonna breeze on through it because most of you got this thing right. And for those of you that needed a nudge, it didn't take long. So you guys already know we're looking for that obstetric anesthesia code. It's for planned general anesthesia for this cesarean hysterectomy. And then you take a look, you want to focus in that it was planned. All right. So we start out with code 101962. This was anesthesia for an urgent hysterectomy. We know that was not the case. Okay. Not urgent, but planned is what we are looking for. All right, so we then go on down here to code 01963. This is anesthesia for cesarean hysterectomy without any labor anesthesia or anesthetic care. All right, no labor because it was planned. All right, without any labor. So if you want to put that little note there by that code in your book, you may. We're going to give that a lot. Yes, because we need to check out the following answers. We already know straight off the bat we could have taken 01969 off. It does not matter what it reads because it is an add-on code and we would not allow that to stand alone. So that one is out of there. 01967, neuroaxial labor anesthesia. No mention of that at all. Okay, this was not a planned vaginal delivery. Okay, this was neuroaxial labor anesthesia for a planned vaginal delivery. That was not the case, and so we already know 01963. That is a firm code, and that is our correct code. All right, so hey, you guys blew it out the water. All right, I'm gonna give you guys like 30 seconds to locate this. All right, what is the physical status modifier that best describes a patient who has a severe systemic disease that is a constant threat to life? Okay. Are they P1, P2, P3, or P4? All right, guys, I'm giving you about 30 seconds and then. All right, I see you guys have all popped that answers in there. And we're gonna go ahead and do the reveal. Not that it's a big secret, all right. Yeah, it is answer D. And yes, thank you, Miss Cheryl, for keeping me on track. She's like, hey, has it been time yet? Oh, it had been time. All right. So that physical status modifier, hey, we've just got to remember severe systemic disease, constant threat to life. And boom, we just take a look here, hone in on the severe and constant threat to life, and that gets you there. P1, we know that's for a normal patient. This is for a patient with mild systemic disease. And then severe systemic disease is P3, and P4 is severe systemic disease, constant threat to life is P4. And I don't know if you guys noticed, but it really is going in chronological order. As you move along through the numbers, the health and the physical status of the patient gets more severe. All right, we've got healthy, we've got mild disease, severe. They're severe, but now constant threat to life. P5, this person is morbid, not expected to survive. This person is declared brain dead. So if you've never noticed that, hey, that'll give you an idea on how to locate things on site, because had you taken a look at this and you have that in your head, you already know 1 and 2, that's gone. Let me look at these though a little bit closer, okay? All righty, here we go. No worries, Miss Cheryl. All right, we're going to keep it moving, and I'm going to have Miss Andrea come to the floor. Take it away, lady. After she reads, you'll have 2.5 minutes.
All right, coders, we have A, 7:14 a.m. to 8:18 a.m., 64 minutes. B, 7:14 a.m. to 8:29 a.m., 75 minutes. C, 7:26 a.m. to 8:18 a.m., 52 minutes. D, 7:26 a.m. to 8:29 a.m., 63 minutes. Anesthesia start time is reported as 7:14 a.m. and the surgery began at 7:26 a.m. The surgery finished at 8:18 a.m. and the patient was turned over to PACU at 8:29 a.m., which was reported as the ending anesthesia time. What is the anesthesia time reported? You got this, coders.
Al- All right, I think I've got everybody's answers in there. If you have not put that answer in the chat, yeah, go ahead and slide it on in there before we spill the beans and start talking about it. All right, so here we go. We are talking about anesthesia time, and the answer is B. All right, and many of you got this correct. I am loving it. Okay, it didn't take much of a nudge to get some of you there towards the right answer, and so that's a good thing. All right, so that anesthesia start time was 7:14, and at they began at 7:26, they finished at 8:18, and they were turned over to PACU at 8:29 a.m. Okay. The one thing that I would say when you are calculating anesthesia time is to focus on the thing that you need, that start time. All right. And the ending time, which is when they are turned back over. Okay. So the start time, 7:14. Well, this is what we need with the start time. Okay. But we don't need when the surgery started. Okay. That's 7:26. Okay. So don't confuse the two. All right. That'll help you to get there quickly. Anesthesia start time. And then whenever anesthesia isn't on board anymore, we need to know when the patient was turned over to PACU or when the anesthesiologist was no longer present. That is 8:29. So we know that's what we're looking for. We have that there, but this is when the surgery finished. So that doesn't help us. And this is when the surgery finished as well there. Okay, so that's why we're taking those off. And so we know that this is where we need to be. We're calculating it. We're going 7:14 to 8:14 because that's 1 hour. So I think if you haven't used a little circle, if that works for you, you can use it, divide it up into 4 quadrants for 15 minutes each. So 4 of those will give you an hour. We have a little left over from 8:15 to 8:29. That's indeed another 15 minutes. We know that every 15 minutes is a unit of time for anesthesia. So we have 1, 2, 3, 4, 5 of those. All right, 75 minutes. And that gives us our answer of B. All right, so we're going to keep it rolling and move on to our next one. All right, you have the floor, Miss Andrea.
Okay, coders, we have A, $1,200, B, $1,000, C, $1,100, and D, $900. Code 00731, anesthesia for upper gastrointestinal gastrointestinal endoscopic procedures. Endoscope introduced proximal to the duodenum, not otherwise specified, has a base unit of 5. The patient is a P3 status, which allows one extra base unit. Anesthesia start time is 7:37 a.m. and the procedure started at 7:50 a.m. It finished at 8:35 a.m. and the patient was turned over to the PACU at 8:52 a.m. Using 15-minute time increments and a conversion factor of $100, what is the correct anesthesia charge? You got this, coders.
All right, how we doing, coders? All right, I'm seeing some good stuff in that chat. If you have not gotten that answer in there, go ahead and get it in there. I gave you guys just a little bit more time. I wanted everybody to have a little bit more of a moment to get it in there. But hey, if you hadn't got it in there, pop it in there. And if you're not quite sure, put it in there too. All right. So I'll know that I need to focus on this. Okay. So we're going to go ahead and unpack it. All right. So we are trying to figure out what is the correct anesthesia charge for this procedure. And the answer is C. And I'm going to show you how we got there. Okay. So we have for code 00731 anesthesia. They're having an upper GI endoscopic procedure. Our base unit is 5. This is a P3 status patient, so they are allowing one extra base unit. That anesthesia start time is 7:37. Okay, they were turned over to the PACU at 8:59. So you see on this one, that's what I focused on. These things, they're good. It's good information when the procedure started and finished. But for this particular thing that you are looking for, this anesthesia start time, you've got to tease out the anesthesia start time and when was the patient turned over to PACU in order to get the proper time. Okay, so we need increments of 15-minute time increments. So we need the base, that is 5. All right, so we're going to calculate that time in just a bit. We already have the modifying factors. Okay, we've got that modifying factor. We've got that one extra base unit. Okay, right there. All right, so you know where I'm grabbing this stuff. That base unit is here. We're going to wait and calculate this time in just a bit. The modifying factor is 1. All right, so once we add those 3 together, we already have our conversion factor. Okay, and it is of 100. But right now, we're going to calculate this anesthesia time. All right, so we've got the end time at 8:52 because that's when they were turned over to PACU. The start time, we already have it here, 7:37. So we subtract the 2 and we get 1 hour and 15 minutes. Okay, so we already know we're doing what? 15-minute time increments. So if you divide 15 into 60, you could take the hour and take it into minutes. This is 60 minutes. This is 60 minutes for 2 hours. So we need 1 hour and 15. So we've got 15, 15, 15, 15. We've got 15 right here too. All right. So this gives us 5. So we've got 1, 2, 3, 4, and 5. All right. So now we're just going to take these 5 plus 5 plus the 1. And that gives us our 11. And then we're going to multiply it by this conversion factor of 100. All right. And then that gives us 1100. And that's how we arrive at C. Okay. So how you feeling, coders? I think most of you got it. Some people were teetering between the B and the C, and oftentimes it is if you get crossed up on these minutes. So another trick that I used to do is you could say 7:37 to 8:37, and then you take the difference and then you could subtract it out that way, or you could just do it this way. But that's how I used to do it. I would subtract the 2 to get my hour, and then I would take what was left over to figure out, is that 15 minutes? And let me remind you, it does not have to be exactly 15 minutes. Even if this had been 1 hour and 1 minute, you still need another unit. Anything from 1 to 15, you're going to need the extra unit. Okay. All right. Okay. All right. So if you need to get a screenshot of this thing, go ahead and grab it before we keep on moving. That is good to hear, Miss Sonia. I'm glad you have it. All right. And hey, I apologize. I forgot to tell you guys, grab the screenshot on that other one. So grab this one, and then we're going to keep on going. Okay. All right. Here we go, coders. All right. I'm going to have Miss Andrea come. You have the floor, lady.
Okay, we have A 01952 modifier P5 with 01953 modifier P5 times 5 and 99140. B 01952 modifier P5 01953 modifier P5. C 01951 01952 and 01953 times 4. D 01951, 01952, 01953 times 4, and 99140 modifier 51. A patient with third-degree burns over 54% of his body is being treated under anesthesia for excision, debridement, and extensive skin grafting. The patient's condition is listed as severe, and he is not expected to survive without the operation. The operation is further complicated by the emergency condition of the patient, and delaying this procedure could lead to loss of body parts. How should the anesthesiologist report her services for this procedure? You got this, coders.
All right, coders, how we doing? If you have not gotten that answer in there, go ahead and pop it in the chat, and then we're going to hop to it and start doing some explaining. All right, do I have a few more takers? I want to give you guys just a moment more, and then we're going to start explaining. I think most of you have slid that answer in there. I see a few more coming in. All right, here we go. We're going to work this thing through, okay? All right, so we've got this patient. All right, now the answer is A, and I'm going to help you guys get there. You're going to have an aha moment. If you need one, you're going to have one. All right, so here we go. We've got this patient here, and they've got these burns over their body. So I'm going to show you one way to solve it. You know, whenever I can cut to the chase and give you a back door to it, I'm going to give it to you. All right. So this patient has third degree burns over 54% of their body. All right, so we know we have code 01951, anesthesia for second and third degree burns, but this is for less than 4% of the total body surface area. Okay, they were burned over 54% of their body. All right, so 01951 would not be the correct answer. All right. So we can already, I love to get it down to 50-50. Now we can really focus in on these. Okay. So this one, it has the same lead code of 01952 with a P5 modifier. All right. Now we are coding for 4 to 9% of the total body surface area. All right. So we know we need that code. And then the 01953, that is for each additional 9%, okay, of the total body surface area or parts thereof. That is important information to know. Okay, so we've got a code with this add-on code, each additional percentage. And here we know we can use 01953 in conjunction with this. Okay, so don't get thrown with that because you cannot use this code with this add-on code. All right. So if you need to make a note of yourself, if this doesn't exactly speak to you, to leave this alone, you can't use this in combination with 01953. And we need it in this case because this patient has been burned over more than half of their body surface area. So we know we need that code, but just how much of that code do we need? Well, just 9% won't do it. Okay, we need each additional 9. So we got a little math to do, right? So we have 54. If you divide it by 9, we get 6. All right, so we've got 9 right here. That gives us one of them. And then we've got 5 that we need. So we're going to need that code as well. Okay, so we've got the 9, we've got the 9, we've got it 5 times. So that's 9. And then 9 times 5 is 45, plus the 9 will give you 54. All right. So that is how you get here. This one, we don't have enough of the code. Okay. And then the 99140. Okay. Well, I'm going to show you that one because I'm going to walk through all of it. All right. But this, we could have solved it that way. Okay. So we're going to go ahead and we're going to take a look at the second way to solve it. All right. So severe, not expected to survive. All right, we're not surprised about that with that P5. Remember, I told you, notice the order that it goes in. So we know we need that P5. That's not even on C and D. Okay, so now we're going to take a look over here. We know with the anesthesia, this condition of the patient is emergent. Okay, so we cannot delay. All right, so we know that's why we're going to need this here. Okay, 99140. Okay, emergent condition. We cannot delay giving this person treatment. All right, so emergent is defined as existing when delay in treatment of the patient would lead to significant increase in the threat of life. All right, so we already said that it's emergent, could lead to the loss of body parts. Okay, so yeah, we know that we would need that 99140. Okay, so we could have done it that way as well. All right, so how are my coders? All right, let me go back. If anybody needs a screenshot, okay. So is everybody clear on this one? I think most of you got there. I just want to be sure everybody's clear on how we got there. If you missed it just a bit, and I gave you 2 different ways on looking at it. So yes, these add-on codes of qualifying circumstances, they can help you. That's why I was making sure you understood what P1 through P5 meant, as well as these add-on codes that can help you to eliminate, and like it said, as many things as you can eliminate straight off the cuff, do it so you can focus in and be forensic on what remains. Okay. All right. If anybody needs a screenshot, go ahead and grab that thing, and then we're going to keep on moving, guys. Okay. Here we go. All right, so I'm going to take this short and easy one. All right, good to know, Soma. All right, so here we go. We have A00320, B00326, C00320, 99100, D00326, 99100. A 9-month-old child is taken to the operating room for removal of a laryngeal mass. What is the appropriate anesthesia code? All right, coders, your time, it starts now. You've got 2.5 minutes. All right, guys. That is more than time. So I think everybody's got answers in there. And we're going to go ahead and unpack it. All right, it's B. All right, so I had a little bit of a split between B and D actually. And so this is going to be an aha moment. All right, so why do we only need 00326? I'm going to tell you why. This is a 9-month-old. They are having a laryngeal mass removed. All right. So for 00320, this is for a patient that is 1 year of age and older. Already we know that that code does not account for the fact that this is a 9-month-old tyke. So no to code 00320. We're going to keep it moving. Look at there. I love it when we can eliminate 2 right off of the bat. That is right. Some of that parenthetical guideline, it's going to tell the tale. 00326. All right. I love it. And we have it in both. It is for indeed this patient that's younger than a year old, and it is for anesthesia for all procedures on the larynx and trachea. So we know we're in the right place. All right. So there we go. Now, there it is. Do not report 00326 in conjunction with 99100. Oh, man. Yeah, that's a good code, but we can't use it with this. So that one's off the table. And we see here, yeah, we would use it, all right, for a patient that would be younger than 1 year of age, but not in this case. And it tells you again, even right here, it's saying, don't use me. I'm a good guy, but I can't do you any good here. Look at that. For procedures performed on infants younger than 1 year of age, it's listing the codes that you can't use it for. And there is our code right there. So it's warning us 2 times over, do not use me. And so 00326 is all that we need. One thing that I do, you should highlight your parenthetical guidelines or whatever you're using to just draw your eye. Whatever is your thing, then you do it. Okay. Coding and chunning is very specific depending on the coder. Okay. So do what you need to do to draw your eye. For me, I limit the amount of highlighter that I do, but do not things I box in red or I put this do not code. Just like you see me up on the screen is how I notate in my CPT manual. I like it to be concise and not too wordy, not too much. So this lets me know, what is it that I can't do? All right. Okay. All right. If you need to get a screenshot, guys, you may. And then we're going to keep on moving in 5, 4, 3, 2. We are moving on. All right. All right. I'm going to call Miss Andrea to the floor. You have it. And after she reads, you guys know the drill. You got 2.5 minutes.
Okay, coders, we have A00834 modifier P2 99100, B00832 modifier P2 99100, C49560 00834 91000 modifier P2, D00832. An anesthesiologist provides general anesthesia for a 72-year-old patient with mild systemic disease who is undergoing a ventral hernia repair. How would you report the anesthesia service? You got this, coders.
All right, how's everybody doing? I think most of you have gotten that answer in the chat. So we're going to go ahead and unpack it. All right, so here we go. All right, so the answer is B, and many of you got there. I'm loving it. So you guys considered how could you eliminate two of these on site? You know I gotta go there, right? There we go. We're gonna hone in again on those qualifiers and things and the P1s through 5s. Okay, so how could you have eliminated it? This patient is 72 years old. So what does that tell me? That tells me that I am going to need that 99100. Even if you don't know the exact code, you know you're going to need something about this qualifying circumstance. And this one here, it doesn't have that. Okay, so right there. Doesn't have the P2 for the physical qualifier, and it doesn't have the add-on code for the qualifying circumstance because this patient has mild systemic disease. All right, so that one would be gone. All right, and C would be gone. You do not use surgery codes when you are reporting the services of an anesthesiologist. All right, so let that simmer. Let that simmer. All right, okay, so I'm going to bring it on over here. We've already eliminated these, and I've already told you why. All right, so here are your reasons why we've eliminated those straight off the cuff. So now we can hone in on these. And this is all we're looking at because everything else is the same. So we just need to differentiate these two codes. So for code 00834, this is for anesthesia for hernia repairs in the lower abdomen, not otherwise specified. This is for a patient that is younger than 1. We've already said this is a 72-year-old patient. So already we're not going to use it. And also, we would not report 00834 in conjunction with 99100. So it's wrong on two fronts. Okay. We wouldn't use 99100, and we would not use it in conjunction with this. Okay. Too little or too young, and then we wouldn't use this particular add-on. So it only leaves us with B, anesthesia for hernias, lower hernia repairs lower than the abdomen. All right, not otherwise specified, but we need this one because this is what we're grabbing, that common language that's before the what? The semicolon. That's what we're getting because ours was specified. It's a ventral hernia. So that's why it's 00832. Okay, ventral hernia. And there we go. That's a good code. And we've already talked about these modifiers already. It is a P2. And there we go. All right. And so all that stuff you already know now. P2, and we do need the 99100 because the patient is what? Older than 70, or you should have in your book 71 and older. If you have not put that there, you should put by code 99100 71 and older or 11 months and younger. All right. Okay. So if you need to get a screenshot, go ahead and grab it. And then we're going to keep on moving, guys. Okay. You guys are doing some outstanding work this morning. I am loving it. I'm seeing aha moments because that is exactly what group study is for. Okay. All right. I guess I'll be nice and read this one. That's right, Sonia. Let it simmer. All right. So we're going to do A 01260 with a P2 modifier, 99100. B 01272 with a P3 modifier. C 01272 with a P2 modifier, 99100. D 01270 with a P3 modifier and 99100. Mr. Johnson, age 82, having been in poor health with diabetes and associated peripheral neuropathy, is having a FemPop bypass. The anesthesiologist documents he has severe systemic disease. What code or codes is or are correct for anesthesia? All right, guys, you've got 2.5 minutes and your time, it starts now. All right, coders, how you doing? All right, so I'm gonna go ahead and unpack it. I know I'm whispering. I hate to disturb you guys because I feel you. I know you are working so diligently there. And I just don't want to say time's up. But it is. We're gonna go ahead and unpack this thing. All right. So let me take a look in the chat and be sure that I have given everybody ample time. And if you need more time, you can slide it in. But if you've given me your answer, let's see. Yeah, all right. So, all right, let's go ahead and unpack this thing, okay? I had a couple of you that weren't quite there. You were close, and I'm going to give you that nudge, all right? So, no worries there. That is exactly what group study is for. Your answer is D, all right? So, how did we get there? Mr. Johnson is 82 in poor health with diabetes, associated peripheral neuropathy. They're having a fempop bypass, and this patient has severe systemic disease. How could you solve this one on site? All right, all right. I'm gonna tell you that physical status modifier. Look here, I'm gonna make y'all proficient with those things. Look at there. P2 is what we need, okay? Remember I told you it really goes in chronological order. This patient is in poor health. So we're gonna need the P3 modifier and no qualifying circumstance modifier. All right, so that's not on that one. We know we need it because this patient is 82. Remember, I was telling you with that 99100, when you're talking about anesthesia, if a patient is 71 or older, you're going to need it. And it's not on this one. And this patient is not of P2 physical status. They are a DP3, and boom, you're at D. All right. So we're going to go ahead, though. I'm going to show you how we do it by going through the codes as well, okay? I'm not gonna stop there. I'm gonna give you the whole picture. So here we go. We've got a fempop bypass for 01260. All right, this is anesthesia for all procedures involving the veins. All right, that's the sticking point right there. All right, we need a fempop bypass. It's a bypass of femoral popliteal arteries in the upper leg. This is for veins, okay? So 01260, that one, it's off the board. All right, that's coding for veins, not for arteries, and that's what we need. We need something for arteries. So we're going to continue on. We have this code family here. We have 01270, and this is anesthesia for procedures involving arteries of the upper leg, including bypass graft. Yeah, I like that language. Okay? All right, but there we go, involving the arteries, including bypass graft. That's exactly what we are needing, okay? So we're going to give that a light yes. And we're going to continue on for 01272, femoral artery ligation. There was no mention of that. Nope. All right. That's specifically for femoral artery ligation. No, no one said anything about that. That's the wrong procedure. That's off the table. And that is how we end up with D. All right, for 01270 with the P3 modifier and the 99100. Okay, and here are your modifiers to remind you again. The P3, all right, that is for a patient with severe systemic disease. Okay, and the 99100, that is for our physical status for this, and our qualifying circumstance, this is for extreme age. Okay. All right. And that's how we got there. All right. That's your qualifying circumstance. Okay. All right. Yeah, that's okay, Susan. Remember, I was telling you guys, have it in your head. Yeah, 1 is normal, 2 mild, 3 is when you need to start looking like, okay, what's exactly they're talking about? But yeah, just quickly take a look. If you see these modifiers, any of you guys, then take a look, okay? No worries, Soma. You guys are doing good. You guys are doing good. I'm glad to hear you're making more notes, Susan. Yeah, yeah, good. Perfect, guys. Okay, if anybody needs a screenshot, Go ahead. Okay, I can go back that one slide. So give me one shake here. Let me go back for you. All right. Is that the one you need right there, Sonia? You need one more? Is it before that one? Okay, so you got that one. Okay, hold on. All right, so we're going to go ahead and do this one because then I need to switch gears so we can get some radiology in there. If you guys breeze through the radiology quick enough and I have enough time, I'll double back because I have a few more anesthesia scenarios, but we'll go ahead and grab this one and then we'll keep it moving. Okay, so I'm going to have Ms. Andrea come and read us out and give you 2.5 minutes and then we'll get rolling again. All right, lady, you have the floor.
A 00932, B 00934, C 00936, D 00938. What is the anesthesia code for a complete removal of the penis, including removal of both the left and right inguinal and iliac lymph nodes? Your time starts now, coders.
All right, coders, how we doing? I think most of you have gotten your answers in the chat. If you hadn't, go ahead and pop it in there. All right, I'm giving everybody just a brief moment. Let's go ahead and unpack it. Most of you got there, and some of you just need just a little nudge, okay? And that's okay. Again, that is what we're here to do, okay? So, all right. So the answer is C, and Soma, you got this one right. All right. So you guys are doing outstanding. Again, for those of you who were just off the mark, no worries. We're going to get you there, okay? All right. So here we go. All right. We're going to code for this complete removal of the penis, removal of both the left and right inguinal and iliac lymph nodes. Okay. All right. So, like I said, most of you got there. And for those of you who didn't quite get there, it's just a matter of pivoting you just a little in the right direction. Okay. All right. So, did you notice something about this code? All right. This is the code family. And look at here. They're in order 2, 4, 6, 8. All right. So you guys know anytime I can just quickly look at something and assess the situation, we're going to do it. All right. So we are coding for the complete removal of the penis, including removal of both the left and right inguinal and iliac lymph nodes. This right here is saying anesthesia for procedures on the male genitalia, including open urethral procedures. So this is the general code language that we need. We need something a little more specific. So let's see what this code family has to offer. So we start with 00932. Again, like I said, it's going in order 2, 4, 6, 8. All right, complete amputation of the penis. Well, they are removing the penis, but we've got a little more going on. So this one is not coding for the lymphadenectomy. So we're going to take that one off the table because indeed they had the left and the right inguinal and iliac lymph nodes removed. For 00934, this is the radical amputation of the penis with bilateral inguinal lymphadenectomy. Okay. We have the inguinal and the iliac lymph node. So this one, this is missing the iliac lymphadenectomy. All right. For the next procedure, we have 00936, radical amputation of the penis with bilateral inguinal and iliac lymphadenectomy. Yeah, that's right where we need to be. We're going to give that a light yes, because we need to check out this final code. Be sure it's not better. And this is talking about something totally off the radar, insertion of a penile prosthesis. We didn't have any mention of that. Wrong procedure there. So yeah, this is a firm code. So 00936 is the code, and the complete code would read anesthesia for procedure on male genitalia, radical amputation of penis with bilateral inguinal and iliac lymphadenectomy. That sounds like exactly what happened there, and that is your code, okay? Oh man, I was not showing my screen. Yikes. Okay. Do I need to go back over that thing one more time, or are you guys okay now that you see the screenshot with its completeness sake? Okay. Grab the screenshot if you need it, guys. I was bringing to your attention that yes, this is a code family, and that if you notice these last 4 digits here, 2468, that is letting you know that these are in order or very close together. And you see here 2468. So once you get here to this parent code, you are just ticking the boxes to find exactly what matches what you are seeing in this scenario. Okay, so no, This one didn't code for the lymphadenectomy. It's okay, but not specific enough. This one was coding for one of the lymphadenectomies, but it was missing the iliac removal. It was only coding for the inguinal, okay, as you see here. When we move down here, this indeed was coding for the amputation of the penis with both of the iliac and the inguinal lymphadenectomies, and this one was for the insertion of a penile prosthesis. That's the wrong procedure. This is how we land there for the correct code. I am so sorry. I forgot to start and share the screen again after I went back to go back to some scenarios that you guys needed a screenshot for. My apologies, guys. Okay, so we're going to keep on moving. So how's everybody feeling about coding anesthesia? Everybody good? All right, good. All right, so I want to know all my coders are good. Give me a thumbs up or a good, because we're going to keep on moving. We're going to get into some radiology. I am glad you're feeling good about the anesthesia, Sonia. Yes, I think anesthesia usually comes to most people pretty good. All right, good. I'm glad you got a thumbs up, Miss Keisha. So we're going to keep it moving. So give me one quick second and I will remember to share my screen. I'm going to put me a sticky up there to remind myself. Don't forget, don't forget. All right, there we go. Here we go. All right, I know I'm sharing my screen now. We're going to move on to radiology, okay? So we want to keep in mind when you are coding radiology, these global charges, okay? The global charge, the provider owns the equipment. They employ the staff, and so they're entitled to the full payment. The professional component, or modifier 26, this is about interpretation. This requires the physician's professional expertise. That technical component, the modifier TC, this is the cost of the equipment and the salary of the technician, okay, whenever you use that component. All right, so we're going to keep moving. If anybody needs to grab the screenshot, go ahead and get it. And then we're going to continue on. All right, so I'm going to breeze through these. I'm going to give you 30 seconds literally with these. Which plane divides the body into anterior and posterior halves? Okay, I don't mind if you got it jotted down somewhere in your book. That is fine. You should. This is open book. Use it. Make it a resource. Okay, so I'm going to give you just a few seconds and then we're going to reveal. Okay. All right. So I think most of you got it. Okay. With some of you were looking at it and you gave me one response. I'm like, no, 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 no. Wait a minute. Let me take another go at this. Okay. All right. So I just ask you those things because sometimes you'll have some questions like this, and also it helps you with driving you to the right answer as well. Okay, so it is indeed coronal. All right, and you have these things in your book. That coronal, it simply divides that body here into front and back halves. Okay, so that's your coronal plane. All right, if anybody needs to grab a screenshot, you can do that And I'm going to keep on going. All right. So, which anatomic position has the patient lying at an angle instead of lying flat or directly on their side? All right. Is it lateral, supine, prone, or oblique? And I see answers going. So I know you guys are barely going to need 30 seconds, probably more like 20. Yeah. All right, we're gonna go ahead and unpack it because you guys already said, yeah, it is oblique. All right, so when we're talking about lateral, this would be right lateral recumbent, or just simply recumbent means just lying down. So they're lying on their right side or they're lying on their left in that particular picture. And if they are supine, okay, we think about up. All right, so that's a way to help remember they're lying facing up. They would be supine, and if they are prone, they are down. Okay. I remember O for the down. All right. So I tell you, one of the instructors when I was going through, she taught me that and I love that. Okay. And then we have the right anterior oblique. All right. And so not quite. There we go. Not quite lying down flat or to the side, but somewhat at an angle. Okay. All right. So if you'd like to get a screenshot of that, just to give you another quick way of just remembering those things, you can. All right. And now we're going to get into some coding. All right, Miss Andrea, you have the floor, and I assure you guys, I'm going to remember to share my screen. Take it away, lady.
Okay, we have A 70554, B 70555, C 70551, D 70552. A patient reports to the hospital radiology department for a functional MRI of the brain. The technologist asks the patient to perform small tasks. He takes the images of the patient at rest and while performing the task. What CPT code is reported? You got this, coders.
All right, coders. All right, I'm seeing those final answers coming in there. All right, so some of you needed just a little bit of a nudge and just a little bit more time to take another go at it, and you guys corrected it, and that's what I love to see. Okay, so we've got this hospital radiology department that the patient has reported to for a functional MRI of the brain. All right, and they're going to take some images while this patient is at rest and performing some tasks. And your answer is indeed A. And how did we get there? All right, we're going to take a look for 70551. This is for magnetic resonance or imaging of the brain, just simply imaging for an MRI. All right, but we need a functional MRI. So while it's an MRI, it is not code specific for what this patient had. So we're going to take that one off of the table. And what do I always tell you? If this parent is wrong, then what's wrong? The dependent that falls beneath it is as well. So when you have this entire code language that's wrong, anything beneath it, you can go ahead and take it off the board if it is one of your choices. And that's what we can do right there. And here we go. You know, I love it when we can get 50-50. Now we can spend our time taking a look at what we need to do for a functional MRI. Okay, this is involving the identification and mapping of stimulation of the brain. Is administered by technology, or when it's administered by a technologist or other non-physician or non-psychologist, use 70554. What? It's already telling me something. Look at there. This is a technologist right there. Before I even get to the code, it's telling me I need to use this code. All right. It is MRI of the brain, functional. It's a functional MRI. Okay. And there we go. That matches what we have there, functional MRI. And it is not requiring the physician or psychologist to administer. That's a good code. And we would not report it in conjunction with 96020. That doesn't apply. All right. So we're going to give it a light yes. We already know it's the code. It tells us there. But what is this 70555? The only difference is this one requires a physician or a psychologist to administer. All right, that is the only difference. And that's not who administered it. It was a technologist. So this 70554, that is your code. All right. So yeah, use all this good stuff right here. Okay. It gave us what? It gave us an indication of the proper code before we even got here. Okay. So definitely, as Mrs. J always says, read everything, make little notations, remind yourself, yeah, if I see this and a technologist or a non psychologist is administering this particular functional MRI, that's what we need. If they're not, and it is the physician or someone, this is the code. But that wasn't the case. So that was the only sticking factor. And this one, if it stumped you, it was an MRI of the brain, but it was not specific enough. Okay. We needed a functional MRI because this patient is they're taking the images while the patient is at rest and performing tasks. Okay. All right. So if anybody needs a screenshot, go ahead and get this thing. All right. And then we're going to keep it moving in 5, 4, 3, 2. We are moving on to your next scenario. All right, Miss Andre, you have the floor. And on this one, as usual, guys, you'll have 2.5 minutes after she finishes reading.
All right, coders, we have A 72084, B 72040, 72070, and 72100, C 72082, and D 72083. A patient needing scoliosis measurements is coming in to have standing anterior posterior, and lateral views of his entire thoracic and lumbar spine. What CPT codes are reported for radiology? Your time starts now.
All right, guys. I know you hear it. I know you hear it. It is time. I think most of you have gotten your answers in the chat. All right. And most of you have gotten this correct too. All right. I'm loving it. Okay. And so for those of you who needed a little nudge, that's no problem because you guys took the nudge and then you arrived at the right answer. So here we go. We've got the scoliosis measurements. They're standing at the anterior, posterior, and the lateral views of the entire thoracic lumbar spine is taken. How do we report it? We need code for answer C, 72082. All right, so how did we get there? We've got 72040. This is radiologic examination spine cervical. Okay. All right, so cervical, we need the entire spine, thoracic and lumbar spine. So not the correct location. So automatically we're going to take that one away. What about these particular codes that are remaining? It's part of this code family for 72081. This is radiologic examination of the spine, entire thoracic and lumbar. Yeah, that's what we just said right here, entire thoracic and lumbar spine. I mean, word for word, we know we're in the right place. So we need to take a look at the codes that fall under here. We already know, look at there, 2, 3, 4. Yeah, something's up. Yeah, they're related. They are dependents. Here we go. So this one, this isn't even on here, but this is only for one view, so it wouldn't be correct. But remember, this common code language is what we're looking at. Everything before that semicolon. I know I say it all the time, but sometimes you just need a little reminder, okay? All right, so here we go. We have 72082. This is for 2 or 3 views. And how many views did we have? We had 2. We had the anterior, posterior, and the lateral views. That's 2. Okay, don't let that anterior posterior fool you. That is one view, and the lateral is the second. So that's some good stuff right there. All right. We didn't have 4 or 5 views, we had 2. So 72083, that's no good. 72084, they are talking about a minimum of 6. We already know, no, if 4 or 5 wasn't it, that sure isn't it. We take that one away, and indeed, 2 views, 72082. That is your code. All right. All right. So if anybody needs a screenshot, go ahead and get that screenshot. And we're going to keep it moving because I want to cover some more ground, guys. Okay. All right. So we're going to quickly go ahead and get in here. We have we have 71046 with a 26 modifier, 74150 with a 26 modifier. B, 71046, 74150. C, 71046 with a 26 modifier, 74150, 71046, 74150 with a 26 modifier. A 41-year-old male is in his doctor's office for a follow-up of an abnormality which was noted on an abnormal CT scan. He also had a chest x-ray, PA and lateral views performed in the office due to chest tightness. He states he otherwise feels well and is here to go over the results of his chest x-ray performed in the office and the CT scan performed at the diagnostic center. The results of the chest x-ray were normal. CT scan was sent to the office and the physician interpreted it and documented that the CT scan of the abdomen showed a small mass in his right upper quadrant. What CPT codes are reported for the doctor's radiological services? All right, coders, you've got 2.5 minutes and your time, it begins now. All right, guys, you know what that means. We've got to start talking about this scenario because I want to get this one in as well as squeeze one more in. All right, so we're going to go ahead and take a look at this thing. All right, so, all right, hold on. I got to get my clock to stop. One sec.
Miss Tamika, we can't
Oh,
hear you.
you know what? Y'all couldn't hear me because I could not get my timer to hush. Thank you, Miss Audrey. I had to restart my phone, y'all. It just kept on just singing. All right. Thank you, Miss Andrea. All right, guys, let's jump into this thing. Okay, your answer is D. All right. And many of you got there. Okay. For some of you that didn't quite make it, we're going to push you in the right direction. Okay. All right. So we've got this 41-year-old male. They are at their doctor's office to have this chest x ray, PA and lateral views read. All right. And it was performed in the office due to chest tightness. They had a CT scan performed at the diagnostic center. All right. And the physician interpreted and documented those results of the CT scan. And indeed, it showed a small mass in the right upper quadrant. So, what happened on this patient's visit? Well, we've got to remember 26 is for that professional component. All right, that pays for the doctor's services. Okay, TC would be for the technician. We know that that's not going to apply. We are dealing with an MD. All right, so we're going to take a look. All of these codes are the same for 71046 and 74150. I know you may have noticed that. So that's not the issue. The issue is the use of these modifiers. Okay, so we already know this is for a radiologic examination of the chest, okay, for two views. We already know PA and lateral, that's our code, all right? So for this one, there we go, PA and lateral, and we have it there. And then we know that they had a CT scan of the abdomen. All right, so we know that that's for 74150, abdominal CT scan, okay? It was without contrast. How do we know that? Because it did not mention contrast. So we know that if the physician doesn't say it, then it didn't happen. All right, so let's talk about these modifiers. For modifier 26, if a medical professional reads the radiologic report at the hospital but is not employed by the hospital, we would use modifier 26. But if the hospital owns the equipment and the medical professional is employed by the hospital, they're both part of the global package. So no modifier 26 would be reported. Okay. But also, when an office owns the equipment and the provider at the practice reads the x-ray and provides the report, the office bills the global procedure, so no modifier 26 would be used. Okay, and so where did he read this? He read it at his office, the x-ray. Remember, they were at the doctor's office. He had the chest x-ray performed in the office. All right, so we know that if it's performed at the office, then that doctor, he owns that equipment. So that's part of the global package. So for this chest x-ray 71045, we would not append this, we would not append modifier 26 on 71046. Okay, so every place that you see the 26 on 71046, we would take that away. Okay. All right. So if you need a screenshot, go ahead and grab it because I'm gonna keep going and this thing is gonna start disappearing. Okay. All right. So grab your screenshot and I'm gonna keep going. Okay. So the x-ray again, it was performed in the doctor's office. So he owns that equipment. So he would not bill using this 26. It is part of the global package. Okay. But for that CT scan, it was performed at the diagnostic center and the physician simply interpreted it and documented it. So therefore, he is going to code the 26 for that, okay? We're going to need it. All right, we already took that one away, so that's what's left. All right, the physician is only interpreting that CT scan, and it tells us there. And so that's why we need 26 on that code. All right. So does that make sense, guys? I hope that that clarified it for you. Those notes that you saw, I actually have them in my book at the beginning of radiology. Okay. So it helped me just to keep it straight in my head. When do I put that thing on there, especially when I would get things like this? Okay. All right. I'm going to quickly move along. I want to get this last one in there. So give me 1 sec, and then I'm going to have Miss Andrea come and read us out on this last one. We're going to do not that one. I need to quickly find this thing. Right there. All right. Okay. There we go. All right, Miss Andrea, you have the floor, lady.
Okay, coders, we have A 76818, B 76819, C 76815, D 59025, and 76818. A 25-year-old female in her last trimester of her pregnancy comes into her obstetrician's office for a fetal biophysical profile, BPP. An ultrasound is used to first monitor the fetus's movements, showing 3 movements of the legs and arms, normal. There are 2 breathing movements lasting 30 seconds, normal. Non-stress test of 30 minutes shows the heartbeat at 120 beats per minute that increase with movement, normal or reactive. Arms and legs were flexed with fetus's head on its chest, opening and closing of a hand. 2 pockets of amniotic fluid at 3 centimeters were seen in the uterine cavity. Normal. Biophysical profile scored 9 out of 10 points. Normal or reassuring. What CPT code is reported by the obstetrician? You got this, coders.
All right, guys. I know I'm starting to talk just a wee bit more, or I might just be on it. I'm not sure, but hey, we're going to go ahead and get this thing done because I don't want us to run out of time. Okay. So, this patient is 25 years old. She's in her last trimester of pregnancy, and she's at the obstetrician's office for a fetal biophysical profile, or BPP. An ultrasound will first monitor the fetus's movement, and she's going to have a non-stress test. Okay. And the biophysical profile scored 9 out of 10 points. And the answer is A. How did we get there? Let's take a look at 76818, 76815. I'm sorry. This is for simply an ultrasound of the pregnant uterus. It is for a limited examination. That's not quite enough of what we need, okay? And that we had more going on. She's got a non-stress test. She's got She's got a non-stress test. She's got several things going on. Let me show my screen, okay? So 76815, that would not be the code because this is simply an ultrasound of the pregnant uterus and it is limited. It's just looking at the fetal heartbeat, the placenta location. We have more going on. We've got this NST, we've got the BPP. So 76815, we're going to take that one away, all right? We're going to continue on. We're going to take a look at 76818. That is for the fetal biophysical profile with non-stress testing, okay? This is for the BPP, okay? Did they have this non-stress testing? Of course they did. That's what they're in the office for, this BPP. So we need that, okay? We need the non-stress test and we need this fetal biophysical profile, okay? So that's with the stress testing. That's a good thing, all right? So we're going to hold that and give that a light yes. What is the difference between that and the 76819? This one is without the stress testing. We had a stress test, okay? So 76819, that would not be correct, all right? Now, with this 76818, this is in both of them. What is this 59025? Well, we're going to tell you this is for a fetal non-stress test, all right? So we did have the non-stress test, but guess what? It is a part of what? That code right there. So 59025 wouldn't be it. We wouldn't report it separately because, again, it's included in code 76818. So 59025, that would be incorrect. We don't need both. Everything we need is in this code 76818.
Thank you for
All
watching an
right. How we
AMCI
doing,
exclusive
coders?
presentation.
All right. Does that make sense? Go ahead and grab this screenshot if you need it, guys, okay? Go ahead and grab that and that's gonna be it for us today. I tell you, this time goes by way too fast for me. I don't know about y'all, but it goes by way too fast for me. I never can get through everything we need because time just won't permit. Okay, all right. So don't forget, leave us your feedback or survey. Okay, you know why it's important. It does help your instructor help you. It helps me to gauge what works for you. Okay, so let me know what we can do to facilitate your learning, to push you towards passing that exam. It does help AMCI deliver quality classes to you guys. No feedback means no good. We want your feedback. I love to hear from you guys, okay? And yes, I want you guys to have a beautiful, wonderful weekend, coders. Your effort today, it was simply outstanding. Have a fun weekend. Get a little relaxation and I will see you on next Saturday. And before we bid you goodbye, I'm going to have my partner, Miss Andrea. I couldn't do it without her. Come on, lady.
Hey, coders. I hope you guys have a great rest of your weekend. And remember, keep chunning. Chunning radiology will definitely help you to see things like Ms. Tamika said. It'll draw your eye to things and it'll make it so much easier for you to find these codes. Have a great Saturday, and we'll see you next weekend.
Thank you, Miss Andrea. Yes, Coder, she's right. Chun those books. Again, thank you guys for hanging out with us for a full almost 2 hours, okay, and giving it your best. You guys are amazing. We appreciate you. We will see you next week. Have a wonderful weekend and a beautiful week.
Thank you for watching an AMCI exclusive presentation in partnership with AAPC. Until next time.